Here at Cancer Rehab and Integrative Medicine, I am offering telehealth or online sessions for lymphedema treatment. Although the best way for you to get lymphedema treatment is on-site with your certified lymphedema therapist, where they can do hands-on techniques to help you manage or reduce your lymphedema, sometimes that's actually not possible. Some situations where that might not be possible, if you're immunocompromised and you can't leave your house, if you have transportation issues, if you're in a rural area where you cannot get in to see a certified lymphedema therapist, or if perhaps there's a really long wait list, or you're having difficulty scheduling to get in to see your certified lymphedema therapist. These online sessions do not take the place of on-site treatment, but sometimes they are very appropriate in the interim before you can get in to see your certified lymphedema therapist on-site. Before you receive your lymphedema treatment, you need a script from your medical doctor. This is important because we need to first of all make sure that indeed your swelling is lymphedema and that there's not another reason for your swelling. Your medical doctor will also make sure that you're not dealing with a blood clot or an infection, or that there's something else going on causing your swelling that needs to be addressed first before we start your lymphedema treatment. However, once you have that script, once you've consulted with your medical doctor and we're ready to start our online lymphedema sessions, your first session will look like this. We're going to chat first. We're going to get what we call a subjective. So what that means is I'm going to ask you about your medical history. I'm going to ask you about your swelling, and we're going to get a good understanding of how your swelling has progressed and what's going on at this point in time. Then I'm going to be giving you some resources and some ways for you to manage your swelling and your lymphedema at home. One resource is going to be education. I'm going to educate you on your lymphatic system, on the anatomy and physiology of your lymphatic system, ways to reduce your swelling and promote a healthy lymphatic system. I'm also going to educate you on signs of infection to make sure that if anything serious happens while you're at home, you're going to have the tools you need to make sure that you get treated properly. Other things we can do in our online session, I can educate you on how to do your own manual lymphatic drainage. Manual lymphatic drainage is a massage type technique that helps move lymphatic fluid out of the area of swelling. So I'm going to educate you on how to do that yourself. Everything that I educate you on, I'm going to send you worksheets as well as videos that you can follow along to do these things at home. We're going to see if you already have compression for your swelling, if you have compression garments, and if not, we're going to come up with a plan of action to make sure you get those garments. It's very important that compression is a part of your lymphedema treatment to help make sure that that lymphedema doesn't worsen and that that lymphedema can get better. Also, an important part of your lymphedema treatment is movement. The main way your lymphatic system moves fluid through your body is by your muscles contracting and relaxing. So I'm going to evaluate and see your range of motion and your movement and your mobility. And then I'm going to give you a very individualized home program, again with a worksheet, and we're going to go over it here in the online session in order to make sure that you have a home exercise program or a home movement program that will help your lymphedema as well. And most importantly, I will now be a part of your healthcare team, meaning you will have me available for email, for phone calls when something changes or when you are ready to progress your home program. We will follow up as needed, even if it has to be online. We will follow up if anything worsens or if your swelling is reducing and we want it to further reduce. So you will have me available as needed in order to improve your lymphedema, manage your lymphedema until you're able to get in clinic to see your lymphedema therapist. So thank you for considering telehealth physical therapy for your lymphedema treatment. Do not hesitate to reach out to me if you want to have a phone conversation or discuss over email whether this is the right fit for you at this point in time. My email is Angela@Cancer Rehab Austin, and also you will see our website as well as our telephone number in the details of this video. Thank you so much, and I look forward to being a part of your healing team.